you wish, then you do not need to worry about the medical needs. eGlobalDoctors has your back. They have different packages for you, starting from $199 that will give access to 300 plus doctors with 40 plus specialties. Prescription will be provided. Video consultation up to 30 minutes. ID and health passports are also available. You can join the live session via FB as well as on Instagram. So without any delay, let's welcome Dr. Meena. So Dr. Makhijani is Chief of Staff of the Motion Picture and Television Hospital and a geriatrician at UCL. She received bachelor's degree in mechanical engineering from UC Berkeley and studied medicine from Nova Southeastern University College of Osteopathic Medicine. She did a fellowship in geriatric medicine at UCLA and is also board certified in family medicine and integrative holistic medicine. Dr. Makhijani also has an interest in global medicine and she has completed a certification in Ayurveda under Dr. Vasan and continuing her Ayurveda studies. She is also a Bharatanatyam dancer and a tabla player. So, welcome, Dr. Meena.
Thank you so much, Divya.
Yeah. So, Dr. Meena, in today's session, we are going to explore about geriatrics care with you. And viewers will provide the information about geriatrics care with you. So, let's start with our very first question. Sure. What is geriatric specialty?
Geriatrics is a specialty of medicine that pertains specifically to people 65 years and older. So it's similar to how we have pediatrics for, the age group up to 18 years. So this is the other end of life.
Okay. So viewers, as the doctor said, geriatric specialty focuses on providing care for elderly people. So my next question is, at what age a person is considered as geriatric patient?
So it's from age 65. And, some people think, oh, I'm 65, but I'm so healthy and young. And they're still welcome to see a geriatrician because as we start aging, there are certain problems that might arise that geriatricians are just more equipped to deal with. And also, most of the world is now experiencing aging populations, including the US and India. So the US population that's 65 and older is about 16%, and that's projected to keep increasing over the next few years and definitely decades. And in India, it's about 16% of the population. It's about 10% of the population in India, 16% in the US. But in India, it's set to double in the next coming years. And so it's something we really need to be kind of prepared for.
That's wonderful. So let me remind to our viewers that we are live on FB as well as on Instagram. So jump on your favorite social media and get to learn about geriatrics care with our expert. So Dr. Meena, why do elderly people need a specialist as everyone parents?
Mm-hmm. Yeah. So, our bodies change as we age, our mind changes, the way we react to the same illnesses changes, the way we can react and adapt to stress changes. Even the way our body can process the same medications really changes. Our metabolism is affected. And so geriatricians, again, are really equipped in dealing with these changes and how to best suit our patients to understand these changes, to understand even interactions between medications, because as we get older, we end up being on more and more medications typically, and they can interact in different ways in the body that sometimes other doctors are just not fully trained in looking out for. Also, at least in the US, doctors' visits are now very short, about 15 minutes for an average visit. So geriatricians usually have a longer period of time for the visit, so we can really address a lot of the problems that kind of develop in individuals.
Okay. So as the body is becoming old and growing, so they need help and care. Okay.
Yes.
So what are common geriatrics problem?
One of the most common ones I see is dementia and other memory problems like Alzheimer's, other mild cognitive impairment. That's one of the biggest ones people come in for, or their loved ones bring them in for. Other ones are falls, other mobility and movement problems like Parkinson's disease, problems with incontinence, like leakage of their urine, weight loss, so many different things. But again, many times we see different problems coming up together in the same person, so it becomes very difficult and challenging to address them.
Okay, so that's really good to know and very helpful. Like the older people getting the like that's good. I did not know that. So let me tell to all my viewers that eGlobal Doctor is one complete healthcare platform solutions for all your medical related issues and questions. And मजे की बात ये है that you have these services at your fingertips. So you can get the consultation or the need you want by visiting eGlobalDoctors.com. So ma'am, can you explain how you might differentiate between normal behavior disorders due to aging and abnormal behavior disorders that are not age related?
Yeah, that's a great question. So, for example, I mentioned changes in memory. Some change in memory is to be expected as we get older. For example, not remembering where we put our keys, something like that. But then let's say somebody starts forgetting people that they know well, forgetting their names or who they are, like family members and other, close friends. That we could consider is not a normal sign of aging. So we don't expect that dementia is normal and should be expected as we get older. Just one example. But ways that we can kind of differentiate between normal aging and other problems is to really take a very detailed history of the particular problem. When did it start? What's the time course? How have the things changed for the patient? Really, the family is so key in that case because they can kind of give a little bit more perspective many times. Also looking at the medications, was something new just added that is causing side effects that seem like that the individual is facing some major problems where it's really just the effect of the medication. So we really have to look very closely at any recent changes in their social environment, in their family environment, medications, other health issues that can present like something of aging. Like, for example, COVID has caused so many different factors with the brain, like brain fog, for example. So sometimes that's mistaken as dementia, but it's really an effect of COVID, for example. So that's why really looking at the history very carefully can help us with that.
Thank you so much for providing such a useful information. So let me remind all the viewers, we are live on FB as well as on Instagram. So jump on your favorite social media and join the session to know about the geriatrics. So how you identify some common related concerns that the elderly population is afflicted?
How do we, can you repeat that? Sorry.
Yeah.
Did you say how can we identify them?
Yes, yes, ma'am. How identifying some common food related concerns that the elderly population?
Yeah, sure. So food is, such a major part of life. So this is an excellent question too. So one big problem is people lose their appetite. Basically, they just don't have as much interest in food, or even if they try to eat, they just really don't have the appetite for it. This can often lead to significant weight loss, which is a major factor for mortality. Also, people sometimes develop swallowing problems. So really that there's just a constriction basically, and they're not able to swallow, or they start swallowing and feel like they're choking, which makes them very scared to eat. So that's another major problem. Other times different foods start reacting with us or not suiting us as well, causing heartburn, for example, causing diarrhea or constipation. So there's so many things with food that can really make a big impact on our health, especially as we age. And another one is that food is such a kind of, or eating is such a social activity. And as people get older, often they don't have the same amount of company around, and therefore they just don't want to eat. And so that's another major problem.
Okay, so food can cause a number of complications. So we should take care of that.
Yes, definitely.
Okay. So how can I, as a family member, contribute to geriatric care?
Family is super important in geriatric care. So I'm glad you asked about that. So one way is just to really support any elders that we have in our family. So at least in the US, isolation is a major problem, and there is an epidemic of loneliness, they're saying. And in many countries in the West. India, luckily, has such a strong, family system and culture around family that's not been as much of a problem, although that is starting to emerge in India as well. So just keeping in contact with your loved ones, visiting them, speaking on the phone, just keeping that social engagement going is very, very important for older adults to avoid problems with our mental health, like depression, loneliness, but also to stave off, other cognitive issues. So just, any kind of mental engagement is really key. Also, exercise is one of the main things that can help to prevent dementia, as well as, of course, so many problems with the physical body, like blood pressure, diabetes, all of that. So if you can go for a walk with your loved ones, that would also be, very helpful. Also, just observing and seeing if you notice changes, like what you asked about, are certain problems related to age or not, but just kind of being aware and noticing these things. So that you could talk to your elder loved one about them, or even to the doctor to make sure that, is this something normal or is it not? Also, just safety measures. One really big one that I always like to recommend is that older adults, when they're taking a shower or their bath, that they sit down for that, so that they have like a little bench in the bathing area, because so many people fall in the shower that can result in a hip fracture or something else that's devastating. Even making sure that there are no loose, rugs and that sort of thing on the floor that people could trip on, or, tables that are in the way, or little dogs in the house that people can trip on. So there are many just safety issues that you could look out for to help your elders.
Okay, so we need to support our parents or elderly people in their adverse situations of life and assisting them with emotional, physical, and communication needs.
Definitely, it's so important.
Yeah. So are there any medications or vaccines that older people should be given?
So in terms of medications, there are no, prescription medications that I recommend across the board. And in fact, I, very much believe in the theory that we see in Ayurveda and even in Hippocrates, that food should be our medicine, that food is healing. So I think that is really key when we're thinking about this, that to eat the right foods, the right types of foods for our particular, body and constitution, the right foods for our stage in life, the right amounts of foods at the right time, that can have a tremendous impact on our health. Even vitamins, people ask a lot about vitamins, and even, multivitamins were very, very popular for so long, but then they found that they don't really have, too much benefit really. But now there's a new study that says it might help, with some cognitive issues in the future to stave those off. So, those things are always changing. So that's why I can't say that any medication or any vitamin or supplement is necessarily recommended, other than, again, doing the right things for our body with our diet, exercise, movement. But in terms of vaccines, definitely in this era, COVID vaccine, all the boosters that are available wherever you are of utmost importance. The flu vaccine is the next one of tremendous importance. They're actually predicting what they call a twindemic now in the winter, which would be flu and COVID together. And especially for our geriatric patients, flu is very devastating. It can be very deadly. So we definitely want to help protect against that. And then other standard ones, at least in the US, that we recommend are pneumonia vaccines, vaccine for herpes zoster. Those are the main ones that we always talk about.
Okay, so there is not particular any important vaccines, but the COVID and the pneumonia ones are important for the geriatric.
And flu, yes, flu.
Yeah. So okay. So viewers, as the eGlobalDoctors has started a new nutrition and health diet plan, so you can go and check the diet plans for your health and problems at best price. So what are some emotional problems, Dr. Meena, experienced by old people?
Sure. So another great question, because I think that that is not looked at very much by society in general, but older adults suffer very commonly from depression, anxiety. Again, the cognitive changes can also lead to emotional problems where people just cannot really control their emotions, or they might be crying hysterically or very angry or, hitting, and they just can't control it because of the dementia. Even Parkinson's disease can lead to a form of dementia where you might have these similar behaviors. So I would say really the main ones that we can, try to help support are the depression and anxiety. So again, as I was mentioning before, to really try to keep in contact with our elders, to really check in with them if they are experiencing any of this, because many times people don't want to talk about that, or they don't want to burden their families, or they don't want to burden their friends. But from my patients, as they're aging and going through health problems, it is very difficult to adjust and deal with. And so they all tell me it's not easy to get older. So to just for, any of us to really be aware of that and be as supportive as we can, again, engage socially, help them if they need to go places, to drive them. Many times hearing loss is a huge contributor to this, because they just cannot then engage in conversation and feel so isolated because of that. So to look at that as another contributing factor. But then again, anxiety too, as everything's changing in their world and their structure, they're losing family members, they're losing friends. They feel often very alone and don't know what's, next for them. So that's something that can be very crippling, actually.
Okay, so like the most commons are anxiety and depressions.
Yes.
Okay, so viewers, we have variety of featured categories as diabetes remission, detox program, weight loss, child nutrition, gut health, menopause nutrition support, reversal of PCOS. And 3 months and 3 weeks plans are available for you. Also, you will get 2 free nutritional consultation with holistic nutrition coaches. So you can visit eGlobalDoctors.com for the more information. So doctor, my last question is, what are some challenges of geriatric nursing?
Geriatric nursing. Well,
yeah.
If let's say it's a patient who is in a nursing home, or who's needing, they might be at home, but they are needing quite a bit of care, like they might be bed bound, what we call, meaning restricted to bed because they just don't have the capability to walk and move anymore. One of the huge things we worry about is bed sores. So literally sores that form from pressure, from lying in bed or lying against a chair, that can form on the buttocks area, on the back. This is a major problem, and it can lead to very significant harm to the individual. So for nursing or even family members to be turning that individual very regularly. So we recommend every 2 hours they need to be turned to avoid that. So that's a big challenge, to be able to have enough staff or help or strength to turn somebody like that. Another big one is for incontinence, so leakage of urine or even of their bowels. Sometimes people can't control that, and so they need to be cleaned and changed very regularly. If they're not, of course, that can lead to other problems like skin breakdown, infection, etc. So that's something so important. The other one is for nutrition. So many times people cannot feed themselves, and so the caregiver or the nurse has to make sure that they're feeding them, which is very time consuming. And sometimes, I've seen in nursing homes, the staff doesn't have time for that. And so the individual is then left to not be able to get the nutrition they need, or even that satisfaction, because we get a lot of pleasure from that act of eating and tasting the food and feeling it in our mouth. And so sometimes that is lost. So a nurse, geriatric nurses are very special and so important. I mean, they do so much and are often underappreciated, but really they have such an important role that they play.
Yeah. Thank you so much, Dr. Meena, for providing such information. Before ending this session, let me check if we have any questions.
Sure.
Yeah.
While you're checking, I can mention my involvement with eGlobalDoctors that I was very happy to have during pandemic last year. I mean, the Delta outbreak last year. So that's how I got connected with all of you. My parents found out about eGlobalDoctors on a WhatsApp group, and I was desperate to help my motherland however I could during that really horrific time. And so I got to join your group and, you know, make call. I'd come home from work every day and get to make calls to patients and their families in India who were suffering and didn't have enough resources, and met a really amazing network of doctors that you've collected. So, you know, thank you for all that you did during that time.
Thank you, Dr. Meena. We have no questions. So viewers, if you have any if you need any help or medical need or primary consultation, you can connect to our doctors by visiting eGlobalDoctors.com, and you will get 2 free nutritional consultations with holistic nutrition coaches on eGlobalDoctors app. So what are you waiting for? Go and register now and take the consultation. Thank you so much, Dr. Meena, for providing such useful information. So thank you everyone joining the session. So it's a wrap.
Thank you for having me.